Hi, my name is Christina Johnson. I am nervous about this. I've been doing this all day long, but I don't know what, so I don't know why I'm nervous. But anyway, I'm going to gather my equipment. We're going to get Mr. Shepherd and Ivy. I am doing scenario number one. I have Mr. Shepherd, a 72-year-old male, admitted for COPD exacerbation. He has a chronic trach that he maintains at home with the assistance of family. I was going to try and do this at work. I had access to an IV pole and infusion pump and everything else, but it was kind of a rough day, so I just decided to come home. But the med orders are Rocephin, 1 gram IV daily. The volume is 100 mLs to be infused over 30 minutes, and the drop factor for the tubing is 10. The drop factor, how you calculate that is you divide 100, you find out the mLs per minute, and you multiply that by the drop factor for the tubing. So 3.33 mLs times 10 is 33 drops per minute. The next thing you want to do is gather your equipment, check your MARS, look at your MARS, look at the orders, make sure that the antibiotic is compatible with the fluids you're infusing. In this scenario, Mr. Shepherd has D5 half NS at 100 mils per hour. So you want to check compatibility. There's many programs out there. I have access to LexiComp. I actually did check it at work. It is compatible. So now I'm just going to, I've got my equipment in the room. I have assessed compatibility. I'm going to wash my hands. I'm going to gather my equipment. I'm going to pull this from, we have an Omnicell at work. So I'm going to access the Omnicell, put my numbers in, find my patient, find my med, pull my meds. When I'm pulling my meds, I want to verify that against the MAR. Want to verify that it's the right patient, the right medication, the right dose, the right time, the right route. If I'm pulling from my Omnicell, this one I happen to write it on here so it's a little bit easier. So I am using this as a patient label. I'm pulling Rocephin, 1 gram in 100 mLs, and I'm going to infuse it over 30 minutes. So I verified that the patient label is correct. I'm going to go ahead and close my Omnicell. I'm going to gather my stuff. I'm going to take my computer. I'm going to go ahead and start heading to my patient's room. I'm going to go ahead and knock on my patient's door. Introduce myself. Hi, I'm Christina. I'm the nurse going to be taking care of you today. I have an antibiotic for you. Can I please verify your name and date of birth? Do you have any drug allergies? So today I'm going to be giving you Rocephin, 1 gram. The doctor's ordered this for you. You have COPD exacerbation, and he's ordered antibiotics for you. You have some fluids running, so we're going to hang this on a piggyback and see, I'm sorry. And we're going to hang this on a piggyback, but first, can I assess your IV site? You assess the IV site. You want to make sure there's no infiltration, redness, any pain. He's got fluids infusing at 100 mLs per hour, but I still would like to flush the site to make sure it's a good patent IV before I start my antibiotics. I am going to go ahead and wash my hands. I'm going to go ahead and look at my packaging. I'm going to open my package, verify again that this is the correct medication for the correct patient. I'm going to verify the medication against the MAR. I don't remember if I asked name and date of birth, so I'm going to ask again. Can I please get your name and date of birth? Do you have any drug allergies? there's no drug allergies. So I'm going to go ahead and start with getting your piggyback ready. I'm going to go ahead and wash my hands again. For this, I'm actually going to put some gloves on. It's always good to have gloves on anytime you're dealing with patient care. I should have put gloves on before I flushed his line. I wasn't really thinking about that. I usually have gloves on when I walk into a room. For this, I'm going to get a couple of alcohol swabs, just to make sure I have them handy. I have my tubing here. I'm going to go ahead and open the packaging. One thing I like to do before I do anything is drop my primary fluids. Primary fluids should always be hung below secondaries because they work with gravity. I'm going to go ahead and hang that below. This seems to be maybe the first antibiotic that Mr. Shepherd has gotten, so I'm going to go ahead and just monitor. We want to make sure he doesn't have any reactions to it. So right now I have my medication, I have my tubing, my primary is hanging down. So first I'm going to go ahead and get this ready. We have tubing here. We want to keep these covered until we absolutely need to uncover them. So right now I'm going to clamp my tubing. I'm going to clamp my secondary. Right about now is the time that I can label my meds. Usually when I'm going to go ahead and label my tubing with, according to facility policy, my primary tubing unfortunately has not been labeled, so I should throw this away, but I'm going to go, for demonstration purposes, I'm going to keep it. I'm going to just go ahead and assume that, not assume, you shouldn't assume anything. You actually should get brand new tubing for this if it hasn't been labeled, but we're going to go ahead and label this. So right now my tubing is clamped. I'm going to spike my antibiotic. I usually have a trash can right under me, but for right now I don't. I'm going to take this off. I want to make sure not to touch the inside of the spike to anything else. I want to make sure that nothing touches this. We want to maintain a clean environment. So I'm going to undo this. I'm going to spike my bag using a firm twisting motion. I am going to back prime. Considering the D5-NS is compatible with Rosefin, I am going to go ahead and I'm going to hold this for a second because I'm going to work with my primary now. Here, I'm going to do my alcohol wipe. I'm going to grab my tubing and I'm going to scrub the hub. I like to give these a really, really good scrub because it's going in the IV. So I'm going to scrub again. And I like to scrub around the edges also because we never know what's around. Making sure not to touch this, I'm going to uncap my secondary and I'm going to go ahead and screw this in, making sure not to touch anything else. I'm going to screw this in. I'm going to make sure it's nice and tight, and I'm going to let this go. Throw that in the trash. The reason you would back prime is to make sure that sometimes you want to make sure that they get all their antibiotics. You want to make sure that they get all their medications. Some medications you can waste out, but things like potassium, magnesium, antibiotics, you always want to make sure you get all the med in. So here I am going to unclamp and I'm gonna, by gravity, and if you see the little air bubbles coming out, we want to make sure we do this to make sure that it stays a closed system. So I got some primary fluid barely in the drip chamber. I'm going to squeeze this and fill it to the little line about halfway. And I'm going to go ahead and hang this. I'm going to make sure that the patient's name, medication is on here. I'm going to make sure that this tubing is labeled according to facility policy. I'm going to make sure this tubing has been labeled according to facility policy, or if you are not sure, you swap out the tubing. It's better to swap it out, label it, make sure you have followed proper procedures and protocols. So I'm going to go ahead and let this infuse on the patient according to the physician's order, which is going to be 33 drops per minute. I'm going to unclamp this so it starts infusing. If for some reason it is not dripping into the chamber, you want to find out why. You want to assess the site. You want to make sure that this is actually clamped right now because I clamped it. You want to make sure that there is no infiltration. First, you want to check the patient. You want to make sure there's no infiltration. If there's no infiltration, check for kinks. Check to see that your primary tubing is not clamped. And then go ahead and infuse the fluids. Keep an eye on the time. Thank you for letting me hang your antibiotic. I'll be back to check on you in about 30 minutes. I'm going to go ahead and take my gloves off. I'm going to perform hand hygiene, and I'm going to exit. I'm going to come back after 30 minutes. First, I'm actually going to document that I have hung this. Usually you scan it, document it that way. Before I exit it, I am going to document that I hung the medication. So, I forgot that. So now I'm coming back after 30 minutes. I'm going to make sure that the medication has infused. When I enter the room, I'm going to wash my hands, look at the medication bag, make sure it has infused. If it has infused, his primary fluids should go. They should be running. So you want to make sure that the primary is running, make sure it's set to the right amount. I'm going to wash my hands. I'm going to put some gloves on. I'm going to come and clamp the tube, and I'm going to undo the tubing, and I'm going to take this and discard it. If for some reason they are getting several rounds of antibiotics, you can put a cover over this to maintain a clean tube, and then reuse the tube for as long as your facility protocol allows you to. You want to make sure that you document that the antibiotic has infused. You want to make sure that there are no reactions, no reactions to the antibiotics, especially after a first especially after a first antibiotic has been given. If the patient's never had it, or even if he has had it before, make sure that it has been documented that there's no reactions. And go ahead and let the patient know that you'll be back to check on him after a while, and hand hygiene, and exit the room. I think I covered everything. I hope I covered everything. Thank you for dealing with my mess in my room. Thank you.